It's my pleasure now to reintroduce again Dr. Patrick Joseph. He's come on, I think this is the 6th or 7th time he's come on our program to give us an update. I know he's got a little slideshow he'd like to present, so I'm going to turn it over to Dr. Joseph.
Well, thank you, Mr. Mayor. I'm going to try to share the screen with Steve's help, and let's see if this comes up. And there we are. We'll do this. And while this is coming up, I want to reiterate one of the things that Ann mentioned, and you also, Mr. Mayor, specifically about breast cancer. I am very familiar with molecular diagnostics for breast cancer and have been involved with that for a couple of decades. And there is a reduction of new cases coming because there are fewer women getting their routine mammogram. Don't put it off. It is too important. Diagnostics are fantastic for early detection. Please do it. And now I'll get back to what I'm going to address today. I'm going to try to discuss these things today very briefly. We'll take a look at about COVID-19, some of the treatments and outcomes, the contagiousness, a little thing about pets, and then where on the scientific side we see some of the reopening steps that are going forward.
Great.
You say that it was mentioned by Tracy that remdesivir is an intravenous drug. It does work, but it's for hospitalized patients only. And it's a fantastic drug, but we don't have a good treatment for outpatients. So at the present time, there is no medicine for the majority of patients who get this. Although there are 32 to 33 drugs in trials right now, nothing is proving to be the penicillin for this virus. So still to this date, no treatment. Now for hospitalized patients, remdesivir was mentioned, but I want to discuss something different, and that is convalescent plasma therapy. This shows a cartoon of a person donating plasma. This is really, really important. Anyone who has had COVID-19 may be a candidate to donate plasma. And donating plasma is different from donating blood. A blood donor, a routine blood donor, can donate about once every 3 months, but plasma does not take the blood cells. It's easier on a person, and an individual can donate plasma up to twice a week. The plasma that comes from a person who has had COVID is used to deliver the antibodies to people who are very sick. And this, it's hard to describe what this is like, but when you have a person this sick in the intensive care unit with not a plethora of available therapies, this becomes a fantastic drug. It's much more effective than remdesivir and has reduced the mortality rate by 50% compared to those who don't have access to it. So if you have had COVID-19, I encourage you to contact the Red Cross. They'll give you the guidelines that have been established nationally, and you may be a plasma donor. And one donation can save 2 or 3 lives. So it's an extremely important thing to consider. Now, one of the new information that's coming out about this virus is how dangerous it can be before a person gets sick. Now on the cartoon on the left shows that the virus comes out each time we breathe. It's a lung virus. It's down in the lungs, but it comes out each time we breathe out, and it can circulate in the air. And the cartoon on the right that looks like it's a train station shows that many people may be carrying this virus and not be sick. This represents the source of infection for at least a third of the people who get sick, which means that a young person who's not so much worried about whether or not they will recover can spread this to parents or grandparents or even someone in a crowd, and that person could have a very serious life-threatening illness. And what happens is that with this virus, and I think I mentioned this here before, one person before they get symptoms typically infects 2 others. And then each of those infects 2 others before they get symptoms. So the asymptomatic or pre-symptomatic spread of this virus is one of the major problems that we're dealing with in the United States. In fact, it's how we got so far behind. And that's why masks are new for us in the United States in the year of 2020. Masks work. Masks are an exhalation filter. They capture the virus as an individual like this young man may be breathing out and protects those around him. So a mask is worn not so much to protect the wearer, but to protect the persons around him or her. And Steve asked me to show this slide and demonstrate some things again. In the upper left is a mask that is worn by healthcare providers. This is what is used when you take care of a patient who has tuberculosis or COVID. That is not what's being recommended. In fact, there is still a shortage of those, and they should be reserved for healthcare first responders, persons who need to protect themselves. What we're talking about is the standard surgeon's mask on the right, or any of those modifications in the lower left part. Tightly woven cotton or woven cotton or layered cotton is all that's necessary. This is really being done to capture the moisture and to protect those around. And a couple of weeks ago, I was asked, what mask do I wear? And that's what I've included in the lower right. This is quilter's cotton. It is the most tightly woven cotton that is commercially available. One layer works. This was prepared for me by a friend using a design that is intended to be somewhat scientific, although it does look a little bit like a Disney cartoon. But that's the mask that I wear when I go out into public. It captures anything that I may be exhaling. If I have been infected and don't know it yet, this will protect those around me. Now, one of the things we've not talked about here are animals and pets. It's clear that the coronavirus that causes COVID-19 is not limited to only humans, but it can infect various species of animals. The Brooklyn Zoo had a problem with the large cats, and there were many who got infected, but dogs and cats, that is our pets, can be infected. I want to clarify this, however. It seems to go so far only from humans to animals. So far, we have not seen any spread from a dog or a cat or a house pet back to a person. So it's not necessary to try to find a mask for your cat, as suggested on the right. That is a cartoon, and it's meant to be something that is not necessary. And so far, at least to the best of my knowledge that I was able to find last night, no house pets and no large animals in zoos have died from this virus. So they can catch it, they get a little bit sick, they do cough just like we do, but they seem to have a better recovery rate than us, probably because this virus is not as well suited to that species as it is to us. No special precautions are necessary for your pets. Continue to enjoy them. And if we see a change as dog parks open, then we will address that accordingly. But right now, be comforted that nothing is necessary. So we're going to talk about reopening, but I thought I'd change the phrase a little bit to the pre-opening. The flatten the curve is a phrase that all of us have heard so many times, but sometimes it gets confused. The red curve on there is what happens if we did not take the drastic measures that we did in the United States and certainly in our county. It's not that more people will get infected, but it's too many people would get infected in a short period of time. This is what happened in New York. It overwhelmed the healthcare system. There were not enough ICU beds. There were not enough healthcare providers. And if there are not, then that increases the death rate. So the death rate in Manhattan far exceeds the death rate in areas where there is a lower incidence, that is fewer cases per week, fewer cases per month. Now we can congratulate our population and certainly our county and the state of California because we have flattened the curve. We have decreased the incidence of new cases, and we're now having a curve that looks something like the blue curve, or at least it's suggesting that. But we have not overwhelmed our healthcare system, as we heard on this, and as we also heard from Supervisor Anderson before she had to sign off. we are well prepared to take care of new cases because social distancing, wearing masks, stay at home, and all of the orders that have been followed so very well. And I think that we really need to congratulate ourselves. Now, this is the pre-opening. This is what we did until recently, and it was successful. And now we're into the reopening. Supervisor Anderson did a great job of talking about the specifics of the reopening. That is, what is open and when additional things will be open. And I'll give you the science side of that story. On the left, this is how we reopen. During the pre-opening, during the shelter in place, during the very strict guidelines that all were asked to follow, we measure everything that we can measure: the number of new cases, the number of deaths, the cases by age, the location of the cases. And then we create statistics that guide us to making a change. The change is the reopening. And it's very, very specific by our county health officer, what can be done and what cannot yet be done, and what will be done and in what order they will be done. They're very, very specific changes. And as each change is made, the statisticians in our cities and our counties follow predefined measurements or predefined indicators that were alluded to earlier. That is, how many new cases are occurring each week? What is the percentage of positive tests? How many people are being hospitalized? And unfortunately, what is the death rate? That is to say, does the change lead to a problem, or is the change doing a good job for us? And this is done by contact tracing. This is new. In the beginning of this virus hitting our community, most people who were sick were just told to stay home. Those who were tested and were positive were admitted to the hospital. During the reopening, contact tracing is intensified immensely. That means if an individual gets COVID-19 now, that person will be interviewed and will be asked, what did you do during the past 2 weeks? Who did you see? Were you involved with any of the reopening changes? Were you exposed to anybody? And if so, where? And this contact tracing then flips back to tell us if the specific changes were addressed, were harmful, or if the specific changes were acceptable. And we continue to remeasure. So this is the pattern: measure, change, remeasure, new changes, remeasure, new changes. And that's where we are right now. And that's why it's so important to follow the changes in the order that they are released by the county health officer, not to go overboard, but to do what is said, because in the future there will be other changes. And some of those that were released and some of the changes that were made may have to be rescinded. All of this, of course, is for public health. Now, what you see on the right is something that is often not emphasized. When we think about COVID, and I see this every day or hear this every day when I talk to my colleagues, we worry about those of advanced age, those over 65, those over 75, and et cetera. Those are the individuals who get the most serious complications, but they're not the ones who get the most disease. You can see that the age grouping where the most COVID-19 occurs is in the age of 20 to 44. Now, what's important to understand, these are individuals with probably the healthiest immune system of all age groups. So this virus can infect a person with a very healthy immune system. But when I hear a young person say, no, I'm fine, I'm not going to get it, I'm too healthy, that is not correct. You can get it. Individuals of the advanced age, if they get it, do more poorly because their immune system is weak. But the immune system of a young person is not protective against this virus. And of course, what happens is that the younger age group have a tendency to be more social. They have more social activities. They spread it among themselves much more than the elderly that don't have the same social settings, and they represent a risk to those who may have a serious complication and even death. So I'm not saying that the death rate is high in the young people. The death rate is much higher in the elderly, but the acquisition rate, or those who catch the virus, is higher in the younger group. And so this is what we're looking at the reopening. The reopening is likely going to expose more younger persons than older persons. And we need to watch this very, very carefully, because they represent the new wave, or if there is a new wave of elderly persons, it's going to come from the younger persons and the reopening. Now, this was understandable. It was well planned. The decisions that were made by our county health officer and other county health officers take in all of this into consideration, including the possible exposure to the elderly. And that's why we're following this so closely. And then something happened that none of us expected, and that was the protests. And as you can see from these photographs, the protests represented very close contact of young people, most of them not wearing face covering or masks. And we all know that we can assume that there are persons in these groups who are not yet symptomatic, not yet sick, but spreading the virus. Now, I think I said this here before, talking is all that's necessary to spread the virus if you're in close contact. Talking loudly increases the amount of virus that comes out of a person's mouth. So the loud protests increase the spread. And if you look at the bottom, if you want to add fuel to a fire, you make those persons cough by giving them tear gas. Now, I am not saying anything about the protest politically, except that it's something all of us are watching very carefully. And we'll see if this represents a risk. And if it doesn't, that's important. If it does, that's important. I will make no predictions, but I'll tell you what we're going to do is to follow this very carefully. And if I were to do a contact tracing, that is an interview with anybody who is newly diagnosed, it's pretty hard to say everything you did for the past 2 weeks. It's going to be pretty hard to talk about all of the persons with whom you may have had contact within the past few weeks. And it's very likely that you won't even know if you came in contact with a person in a supermarket or someone you didn't know who subsequently was diagnosed. But we're pretty comfortable that if you were participating in any protest, that it's likely you will remember that. So this is going to represent a very important point of contact tracing. And whatever information we get from this is going to be useful. Whether it's problematic or hopefully not problematic, it will be fantastic information. So what happens next? What happens next is not a roll of the dice. It's not a gamble. This is not a time for predictions. This is a time for measurement. What happens next depends upon a great deal of effort at looking to those and at those who get a new infection. And that will determine what we do. It's a very organized, calculated approach to controlling a contagious virus for which we do not yet have a vaccine and we do not yet have outpatient therapy. So that's going to conclude my remarks right now, Mr. Mayor. Let me thank you and thank all of the members of this panel, as I always do. I am so proud to be part of such a wonderful community. I compare what we have done here to what has been done in other communities. And when I sit on committees and I hear what happens in other areas, I can only boast for what we have done here. So thank you so much.
Thank you, Dr. Joseph.
And as we do each week, I try to condense some of the similar questions. So if your question isn't asked in a specific manner, I'm trying to bring them all together. And we did get a few today about, why kids are not allowed to participate in more than one sport under the new orders. And also a question saying, how much additional risk is added to the community when a group of children is being changed daily versus weekly versus every 2 weeks versus every 3 weeks?
I can answer this globally. The risks are unknown. Of all of the changes that we have made, if we knew the risks, then it wouldn't be done in such an organized fashion. But you have to start somewhere. And decisions like this are made by consensus conference, consensus opinions, consensus meetings, and then you pick a decision point and you follow that. And in our county, it may be different from neighboring counties, or it may be different from counties in neighboring states. We're all different, but you have to start. And then the most important thing is follow closely to find out if that decision was acceptable or if it was not acceptable. So the exact risk of any of the things that we are doing is undefined, but it will be defined.
Next question, if a virus droplet should land on an area of the face that is not protected by a mask or glasses, how long does it survive? And does it stay put or migrate to an opening?
Your wheelhouse, sir.
Well, viruses do not crawl along the skin like ants, but they will survive on the skin because the skin provides nutrients to keep the virus moist. We have oils on our skin, which is why they live on our hands. Certainly we have oils on our face. So the most important thing, if a virus happens to get me on the side of the cheek around a mask, it will live there, but it will die usually within 20 to 30 minutes. So it's important not to touch our face and then touch the areas that are of infectivity, which would be our mouth, nose, or eyes. Those are the areas where a virus has to get to cause a problem. So if it happens to hit my ear, chances are if I don't touch my ear and then touch my nose, I will be very safe.
Do you recommend, Dr. Joseph, that somebody should wash their hands and wash their face after being out in public?
I do, but I just do it because I enjoy it. But washing, I have to be honest about this. Washing hands prevents infection. Washing a face does not. So it's not something that we will see as a recommendation to prevent infection.
Dr. Joseph, what's the newest information on because we haven't spoken for at least 3 weeks about the antibody test. Is there much of an update on how helpful they are, how widespread it might be, and is there any guarantee that you can't be reinfected?
Well, there's no guarantees in medicine, but right now, still as of today, with very, very few exceptions of unusual circumstance, no one has been infected twice.
Okay.
So then that concludes science to say that the antibody is protective. So I would say that that's a given at this point. Once you are infected and once one recovers and has a positive antibody test, he or she is protected. The question is, the unknown question is for how long. So it could be as short as a week, it could be months. So the likelihood of what has been referred to as an immunity passport, meaning I have antibody, therefore I don't need to do anything and I can go anywhere and I can create my own circle of friends, that is very, very unlikely to occur. Also, because of the uncertainty, there are no guidelines based on having a positive antibody test. So for example, in extended care facilities, it's going to be recommended that those individuals get PCR testing once weekly. They will not be exempt if they have an antibody. The same thing is true for first responders and healthcare providers and every place where there's a recommendation for routinely testing. And I'm in a situation where I have to get tested every week, but there will be no, I will not be exempt if I have antibody. So that's the update. It is as I said from the beginning, the convalescent plasma is antibody. It saves lives. It's that good. The duration of protection is unknown.
Thank you, sir.